Hi, I'm Dr. Judy Laverch. I'm an associate surgeon at Wills Eye Hospital and have my private practice at Total Eye Care Centers in Mercer and Bucks County. We're here today to talk about laser floater ablation. It's a new treatment for floaters that many patients don't know about. We are one of the few eye care practices in the tri-state area that perform this procedure. This is an important procedure because many people with floaters don't know that anything can be done for them. A lot of our patients come in very frustrated because they have floaters that block their vision, they can't see to read, they can't see to drive, and they've been told that nothing can be done. Fortunately, there is something that can be done. This is a newer treatment that's been around for the last 20 years, but really has been in the spotlight in the last 3 to 5 years. The treatment is very simple. It involves a laser, and we actually laser the floater so that we take the floater from a solid phase to the gaseous phase, so you actually see bubbles floating up while we're doing the laser. The laser doesn't hurt, it doesn't involve any incisions on the eye. It's a treatment with very few risks and complications. First, the patient will come in for an evaluation to assure the floater is treatable. Not all floaters are treatable depending on the size and the extent of the floater, but many floaters are treatable. Following evaluation, we document the floater and then we schedule the procedure. The procedure that day involves topical numbing drops in the eye. We put a lens on the eye to magnify the floater. Then we go in with the laser to actually ablate the floater, where we take the floater and change it from solid to gaseous state. We're not breaking apart the floater. We're actually using very high energies to ablate the floater and get rid of it completely. So during the procedure, the patient will see bubbles floating up from the laser as we perform the procedure. I like to explain to my patients it's like a video game where I'm actually aiming the laser at the asteroid and getting rid of the asteroid for them. The procedure takes about 20 minutes to perform. It's painless for the patients. I may have to have the patient move their eye to get the floater into position for me while I shoot at the floater. After the procedure, you go home with an antibiotic steroid drop. The patient comes back the next day to check the pressure to make sure that the pressure in the eye is good, because I do put quite a bit of energy into the eye to get rid of the floater. As a doctor, it's incredibly rewarding to see patients who are so miserable from not being able to see from these floaters and being able to get rid of their floaters and have them see at their best potential vision.